Great. So today, well, thank you first, Sina, for the introduction, and thank you for having me at this conference. It's a pleasure to be able to speak. So I'll be speaking to you today about my efforts to reproduce a figure in a paper that's been highly cited, and how that led to discovering what I believe is a missing data point. Yeah, feel free to, if you have any questions, to reach out to me either during this conference or afterwards. My contact information is there, and I'll also have it on the last slide. So just briefly, a little bit of background about myself. I think Sina already introduced me pretty well, but
I'm sorry, I've had to mute you. Your sound just got really bad. Wait, I tried to unmute you again.
Okay, is this better?
Yeah, this is
okay.
Yeah.
Sorry about that.
No problem. Maybe it wasn't even you.
Yeah, yeah. So basically, I am part of an MD PhD program at Albert Einstein College of Medicine, which is in the Bronx in New York City. So just a little bit of background, I started programming in 2015 as part of my PhD in cancer bioinformatics. And in 2016, I started using R. And then the year after, I read the paper, which I'll tell you about today as part of a course. And yeah, I'm generally interested in health informatics and in doing research, computational research that can help improve outcomes for people. My interest in reproducibility really started from my advisor, Jessica Marr, who's now at the University of Queensland in Australia. She really emphasized research reproducibility and the importance of it. And so I'm really grateful to her for that. Okay, so I'll just start off by defining reproducibility. So there's actually many definitions depending on the field and on the topic. But one definition that I like is the one that I have here, which is when authors provide all of the necessary data and computer code to run the analysis again and to recreate those same results. I also like this figure that's here on the right that really shows where reproducibility stands in relation to other similar descriptors. So reproducibility is basically when you have the same data and you have the same analysis and you're able to produce the same results. A lot of people feel like this should be a minimum standard for research that involves data. And I think it's also very important for high impact papers that are very influential on their respective fields. So reproducibility is easy to kind of get behind, but it's hard to actually do in practice. And as a result of this, and as evidence of this, a lot of scientists actually believe that there's a reproducibility crisis. And maybe you've heard about this, but there was a survey done in Nature that showing that actually a majority of scientists believe that there's a reproducibility crisis in their respective fields. And when they're polled further to try and figure out why it is that they believe this, there's a list of factors as to why studies might not be reproducible. Relevant to today's talk is that the methods and codes are unavailable. So I'll just briefly introduce the study and the figure that I've tried to reproduce. So this study is titled Mutation in Cancer, Statistical Study of Retinoblastoma. The reason it's so influential is because it provides evidence for something called the two-hit hypothesis, which is that 2 hits in a tumor suppressor gene, i.e. 2 mutations, are required for a cancer to develop. And so this paper was relatively short by today's standards. It only has a single figure, which I'm showing here on the right. And so my goal was to see whether I could just reproduce this figure in R. Simple enough, right? But there are a few challenges. So one, the data was not available in a computer-friendly format, and there wasn't any code or explanation about how the graph was generated. I just want to briefly also explain this graph since I felt like it was important. So basically, this is a scatter plot where we have two types of data points. We have squares representing bilateral cases. In this case, bilateral means that there's patients with cancer in both eyes. And then unilateral refers to patients who have cancer only in one eye. And the x-axis represents the age at which these patients were diagnosed. So you can see they're diagnosed relatively young, in this case, all of them before the age of 60 months or 5 years. So this is a disease that affects children. And the y-axis represents the fraction of cases not yet diagnosed at the age indicated. So it's kind of like a survival curve almost. Okay, so from looking at the paper, I could see that the data that Knudsen used to create figure 1 was probably available in table 1, and I'll show a screenshot of that here. There are 48 cases. We can see the 25 unilateral here, and then the 23 bilateral cases sort of chunked into groups. We see some of the important variables also, so the age of diagnosis shows up right here in both instances. We don't have an explicit y-axis variable, but I'll show you how I attempted to create that. And there's also a side variable, either bilateral or unilateral, implied by these headings here. So the first question was, how do we get this data into R? After looking about, I just quickly realized that copying and pasting followed by manually reformatting would be the easiest solution. So that's what I ended up doing for this case. The data set was relatively small, so it didn't take too much extra work. So here's the data, the first 30 or so rows of that reformatted table. So essentially you have the same variables, and I just added the side column indicating whether it's the tumor is bilateral or unilateral. I then, just to make this a little more open, I eventually developed or put this into an R package, which you can download and hopefully build upon, maybe with some of Knudsen's additional data sets. He has other papers that were published too. So my first goal was to create the y-axis variable. So we had the x-axis variable in months, but we need the y. So this, what I did was to, just using some of the tools from dplyr, just to create a prop of tot, or a proportion of total, fraction of total variable that, that represents the y-axis. And adding to that, so I'm showing you the rest of the code now. Mainly this is just using ggplot to reproduce. This was the first attempt at reproduction of this, of the figure. So we can see there are a lot of similarities. We can see most of the data points that are around where I felt like they should be. So I thought this was a pretty okay start. But when I looked a little bit closer, what I noticed was that my reproduced plot had more data points than the original one. So we kind of saw this stacking of data points, had multiple data points per age, whereas the original did not. So I wanted to look a little more closely and just to first kind of do a sanity check to see whether the number of data points in figure 1 actually equals the number of cases in table 1. So what I did was just, and these annotations are mine here, just to count the number of data points per type of case. And so I was expecting 25 unilateral or circles and 23 squares, just based off of the legend here. But when I counted, I only saw 20 and 17 respectively. So why was this? Where are these missing data points? So to explain this, I'm just gonna focus for a second on the bilateral cases. So again, we're expecting 23 bilateral cases, and we have 17 that are shown on the plot. So what happened to these missing data points? So if we look at the the y-axis, it states the fraction of cases not yet diagnosed at the age indicated. And so this means, this meant to me that I only needed to include one data point per age. And so just as a check, I counted the unique cases per age, and this was a number that I got 18 for the bilateral cases. This still didn't bring me down to 17, which was the number of points that I counted. But what I realized was that the y-axis was actually in a log scale, and so the final data point actually is not able to be plotted because it equals 0, and you're not able to plot 0 when the y-axis is on a log scale. So I did the same, so that was the bilateral cases. I did the same for the unilateral cases, going through the same two steps, but this still left me missing one data point. So I used what I learned, these two steps, applied it, this knowledge again to reproduce this plot, and just added, essentially counted the unique ages and removed that final 0 value from each group, and I got a plot that looked much more similar. But the question is still, where was this missing data point among the unilateral cases? So it's kind of hard for me just to see visually what the differences were. So if you just kind of superimpose the two plots, just making one of them transparent, what we can see is that and the original points are shown here in black, the reproduced plots are shown in gray. There's actually a point here that doesn't have a partner, gray point that doesn't have a partner black point. And so I wanted to look to see what that point was. So I just filtered out, essentially I saw it was between the y-axis between point 12 or so, which was this data point here, and then point 0.20. And I knew it was from the unilateral cases. That's what I was looking for. And so it turned out that this was one of the cases that was not plotted. And we can see that the value here, 0.16, which is where it should be on the black original plot, is not present. Okay, and just sort of as a sidebar, I also realized when I was trying to recreate the fitted curves to this point that, at least based off of the description of the legend, there was a exponent that was also incorrect. So that when I tried to plot the exponent here that was listed in the legend, I ended up getting this red curve here, when in fact the curve that most closely resembled that in the original figure was actually differed by just an exponent. So you can see that code here for reproducing this plot. Okay, so there are a couple of unanswered questions from this plot. So, why was there a missing data point? Could it just have been an error? Also, why was there a log axis? If we're not able to plot, this is data that ranges from 0 to 1. We're not able to plot the last point from each group. And also, why does the x-axis end at 60? There are actually cases that end at 60. The last cases end at age 60 months and 73 months. So like another way to plot this, there are multiple ways, but will be shown as follows. We try a linear y-axis so that we can show these final data points. And we could extend this this x-axis also to show the same. So from my efforts to reproduce this figure, I've concluded that it's possible to largely reproduce the figure, but there's this one missing data point that's sort of unexplained. And I also found that there was this error in the exponent of the stated fitted curve. Also, the question of why the logarithmic axis was used was interesting. The paper itself, just as a note, was communicated, which means that it did not undergo standard peer review, and you can see that here. This is specific to this journal, PNAS, but it's since been discontinued. So this might have been an area where errors could have been introduced through the absence of peer review. And finally, this vignette is part of an R package that's available on GitHub. This potential uses for this vignette or this work could be as a in teaching, so as a reproducibility case study, or for trying to interpret different plotting styles and different decisions in when making graphs. I've included here just a few resources for ensuring reproducible computational workflows. I think there's a lot of information out there, but these are some of my favorite. This first link really provides, I think, the most practical and hands-on guide for our users. So if you're new to reproducibility, this is sort of where I would start, and this is where a lot of my own workflow also comes from. And finally, I also thought it was interesting that eLife is now starting to produce these computationally reproducible articles. So essentially where you have R scripts embedded within the papers themselves, and you can actually go in and edit and change the code and the outcomes in real time. And this really speaks to one of the strengths of reproducibility, is that we can draw our own conclusions. We can ask, what if the data was plotted this different way, or what if we made this other assumption about the statistics here. And so I really think this is a really interesting advance in publishing that we should pay attention to. So.
I have to cut you here. I think you have run out of time. But thank you so much for this great talk. If anyone wants to talk to Daniel, he will be in room A during the break.